Reducing Maternal Mortality by Julie Bethurum at Mercy College of Nursing and Health Sciences of Southwest Baptist University. As a nurse who is passionate about providing exceptional care to women and the newborn patient population, I believe that maternal mortality is a large problem. This problem is important because the U.S. has the highest maternal mortality rate amongst affluent nations. It's estimated that 700 to 900 women die in the U.S. every year from pregnancy and childbirth related causes, and another 65,000 nearly die. So I believe that improvements should be made to the nursing and the patient education process in order to decrease maternal mortality, because many of these deaths are preventable. Importance to the healthcare system. Nurses are frontline healthcare providers, and postpartum nurses should have ample knowledge regarding maternal mortality and the warning signs. That way we can effectively provide comprehensive patient education and consistent messages about the potential warning signs. Nurses may be able to reduce maternal mortality rate by ensuring that the post-delivery education is a top priority and is adequate for every single patient. The knowledge of nurses and the education process may ultimately reduce maternal death and the severity of the complications. So improving this process could benefit the patients, the public, and even nurses. So my question is, for obstetric patients in a hospital setting, does a standardized education program completed by nurses compared to inconsistent teaching methods decrease maternal mortality over a 6-month period? So searching for evidence, I used several different databases, and I found 2 that were most helpful to me in my search, which were PubMed and Medline. I used several others as well, but I just didn't find an article using those databases. So for my most successful search, my search terms and my Boolean operators used were discharge education and maternal mortality and nurses. The limiters that I used were that the articles needed to be published within the last 5 years. I needed the full text available. I needed English language, and I used a subject major heading for the postpartum period, which is what I was most interested in. This resulted in 5 articles for review, and 2 of the articles were discarded after just reading the article titles. And then the remaining 3, I decided to select them after reviewing the abstracts and reading through the article a little bit and discovered the relevance to my question. This search was successful because I had a small number of articles to review, and the 3 out of the 5 articles that were shown were relevant to what I was searching for. With that being said, it did take a lot of trial and error to find the right combination of search terms and putting the Boolean operator in there as well. The 2 remaining articles that I found, I used pubmed.gov. The search terms and Boolean operators that I used for my first search, it was improving quality and postpartum hospital education. And the second one was maternal mortality and quality improvement opportunities. So the limiters I used was the article needed to be published within the last 10 years, full text available English language, and then I also selected human species. This resulted in 22 articles for review, and that was per search. and I only found one article per search. This search wasn't as effective, and there just wasn't a whole lot of information regarding postpartum education on the pubmed.gov. But I was able to find those two, my last two articles. So the criteria for the selection of articles, I was looking for studies that were based in the hospital setting, and I needed to see that the nurses were discussed or somehow involved in the study, because nurses, that's what I'm wanting to look at, is how the nurse can use an education process to decrease maternal mortality. And then, of course, maternal mortality and education needed to be the topics. So summary of findings. My first article that I used was titled Discharge Education on Maternal Morbidity and Mortality Provided by Nurses to Women in the Postpartum Period. And so this study was, the purpose was to explore what types of educational materials and discharge information are currently used by postpartum nurses to educate women about warning signs of postpartum complications, to determine what key messages should be presented to women after birth and before discharge. So the findings in this article was that most nurses described some warning signs related to maternal morbidity and mortality to their patients, but they did not consistently describe signs and symptoms to every patient. And then the other major finding was that the education provided regarding maternal mortality was not a focus throughout the hospital stay, just kind of towards discharge. The second article is Nurses' Knowledge and Teaching of Possible Postpartum Complications. And the purpose of this study was to assess postpartum nurses' knowledge of maternal morbidity and mortality and the information they shared with women before discharge about identifying potential warning signs and postpartum complications. So they found that only 54% of nurses were aware of the rising rates of maternal mortality, and 67% of RNs reported spending less than 10 minutes focusing on potential warning signs on the day of patient discharge. They also found that 95% of nurses reported a correlation between postpartum education and mortality, which I found interesting that they identified that there's a correlation, but spent less than 10 minutes focusing on that education regarded to postpartum mortality. Article 3, do new mothers understand the risk factors for maternal mortality? So the purpose of this study was to describe new nurses' knowledge related to maternal mortality. And the major findings in this article were that deficits were identified in new mothers' knowledge about life-threatening pregnancy complications and warning signs. And then also deficits were identified in like what action should be taken if the warning signs occur and how long they're at risk for complications. Article 4 was improving quality and efficiency of postpartum hospital education. The purpose of this article, or of this study, was to investigate the implementation of an evidence-based, streamlined education process and the nurses' education to improve the quality and efficiency of the postpartum education during hospitalization. So in this study, they had two different groups, one with the standardized education process and one without. And mothers in both of the groups reported that they received a good quality education from the nurses, and the nurses reported enhanced efficiency of providing patient education and viewed the comprehensive discharge education booklet as a helpful tool. And lastly, I have Article 5, which was translating maternal mortality review into quality improvement opportunities in response to pregnancy-related deaths in California. The purpose of this study was to describe quality improvement opportunities, or QIOs, associated with the 5 leading causes of pregnancy-related death in California, and the methods by which the QIOs were collected by the California Pregnancy Association, Associated Mortality Review Committee. So they found that there is a need for trained clinicians, standardized approaches for maternal complications, and ensuring that women understand the warning signs in pregnancy or postpartum that warrant medical attention. This study also found that between 2002 and 2007, there were 330 pregnancy-related deaths, and 41% of those deaths were preventable. So similarities between the articles: action should be taken to decrease maternal mortality rates. That was a common theme that, pretty much all of them said, yes, this is a problem and we need to fix it. Improvements are needed in patient education process, and many new mothers are lacking knowledge regarding maternal mortality and warning signs, and that nurses could improve the education process by using a standardized method. And I did not find any inconsistencies between the articles. A gap that I noticed, or just that there wasn't a study about, was the training or like extra classes that a postpartum nurse needs in order to effectively educate new mothers. And a few limitations that I found may have included recruitment bias, small sample size, RN participation, perceptions, and they may or may not have been supportive of change. And then on one of the studies, maybe the nursing sample was not representative of all nurses who care for postpartum women, and demographics as well, such as income, race, education level, marital status. And then there was a study that did not collect demographics, so that just could not be assessed. Conclusion. So I did not find a guideline in this search. Each article addresses a different variable or improvement measure regarding maternal mortality, such as the knowledge of the nurses, knowledge of the patients, teaching methods, and quality improvement. Alone, each article does not have enough evidence to support change, but because the articles are related, correlations could be made to support change. However, more research is needed for each topic, and maternal mortality is a problem that certainly needs to be addressed. According to one of the articles that I found, prevention of maternal mortality requires healthcare system improvements, clinical training on standardized approaches, and more education for women and their families. And that is what I found during my final literature summary. And here are my references. Thank you.